welcome. I'm Dr. Bhavna Pathak, a hematologist-oncologist and the medical director of integrative oncology here at MemorialCare. I am so pleased to bring you Let's Nourish Ourselves, modules designed to teach us how to nourish our minds, bodies, and spirits, especially with food. Today, I'm joined by our very special guest, Hannah Gross, a registered dietitian here at Saddleback Medical Center. Hannah?
Thank you, Dr. Pathak. My name is Hannah. I'm a registered dietitian and I work with MemorialCare Saddleback. And I'm so excited to be a part of this project. Our team worked in collaboration with Long Beach MemorialCare as well as Orange Coast MemorialCare. And we're very happy to be a part of this.
Yeah, so thank you, Hannah, and bringing your wisdom to the common everyday problems we face when taking care of cancer and our loved ones with cancer or patients with cancer. One of the most common things we experience are gastrointestinal side effects or GI side effects. And this can include anything from nausea to diarrhea. And so I would love for us to go through some of these symptoms and strategies to help manage them. So let's start with nausea. What are some strategies or approaches patients and their loved ones can take to managing nausea?
Yeah, so nausea is a very common side effect that a lot of patients will experience. And so something that can be really helpful to kind of minimize this is to try to eat smaller, more frequent meals. So eating every 2 to 3 hours or so, just trying to keep something in the stomach. You know, we don't want to let ourselves get too hungry, but at the same time, not having, too much in the stomach at one time as well. Also eating more bland foods are going to be helpful to reduce the risk of nausea. So this would include things like crackers, peanut butter, yogurt, popsicles, things like that. Yeah. There's also some foods that patients will want to avoid when experiencing nausea or to help avoid nausea, and that would be things like more acidic foods. So like orange juice, for example, you would want to avoid. Also foods that are very spicy. So whether it's temperature spicy or very flavorful, these can be irritating and induce nausea as well. Also fatty or greasy fried foods. These are all foods that would want to be avoided. Sipping on beverages throughout the day can also be really helpful when a patient is experiencing nausea, just to help to stay hydrated and again, keeping a little something in the stomach. Sometimes smells may also be very bothersome and something that can cause a lot of nausea. So it's really important if someone is experiencing nausea to kind of avoid situations where they might be around strong smells involving food. So for example, if somebody is cooking in the kitchen, there's a lot of food preparation going on, or if somebody is using a crock pot and it's causing a lot of food smells, that's something that would want to be avoided. Also eating in a more well-ventilated area would be a good idea, just to help kind of reduce being around those smells and potentially getting nauseous from that. Ginger and lemon are something that are very helpful in potentially reducing nausea. So whether it's sipping on some ginger tea with some lemon or having some ginger or lemon hard candies, these can be helpful to reduce nausea. Now, if a patient is actively vomiting, it's going to be best to stick to clear liquid foods. So these would be things like broth, gelatin, popsicles, ginger ale, things like that. If nausea is an ongoing issue, you can always talk to your healthcare provider about maybe getting some kind of anti-nausea medication prescribed, and this can really help to reduce some of the nausea, the discomfort associated with nausea. And then just keep in mind, if certain anti-nausea medications don't work for you, then there are other ones available, and so you could always talk to your healthcare provider about maybe trying a different medication until you find one that is better suited for you.
Okay, wonderful. Thanks so much for sharing those tips and strategies. I can tell you that nausea is one of the worst symptoms somebody can experience. It can feel just really defeating, because here you are trying to go through treatment, and the nausea can set you back at eating the foods that nourish you. It just can make you feel miserable. And it's nice to know that there's something besides medicines, even though medicines are a go-to that I prescribe for patients. But something you can do to help prevent it. And from what it sounds like, your food selection, the timing of foods, the frequency, what to avoid, and also the environment in which you're eating can make a big difference in experiencing that symptom. Great. So now moving on to sort of the other end, Manaja is sort of things that come up in terms of diarrhea. Now, diarrhea we typically define as loose watery stools or more than about 3 stools a day. Diarrhea is something we can experience frequently on therapy as well, through a range of different medicinal options, or sometimes even with just the nerves of therapy, right? Just get the anxiety. So tell us about diarrhea in your experience. What can we do, and what can patients do and their loved ones to help mitigate or alleviate diarrhea symptoms?
So similarly to having nausea, diarrhea is also something that one can speak with their healthcare provider about to maybe see about getting a prescription, or even certain over-the-counter medications are available like Imodium to help to minimize that. And now there are also some other things that we can do, like with the nausea, to help kind of mitigate the having diarrhea. So again, it would be eating smaller, more frequent meals. We don't want to eat a huge meal at a time if we're experiencing diarrhea. Same with what foods to choose. So choosing, again, more bland foods, nothing that's going to be too strong or potentially irritating to the GI tract. So again, nothing too greasy or spicy or anything like that. Additionally, high fiber foods could sometimes be irritating as well. So, maybe holding off on foods that are, heartier, kind of whole grain, like very fibrous foods. Certain carbonated drinks and drinks with caffeine, such as coffee or tea, can also be irritating and cause diarrhea. And then certain individuals may not tolerate dairy as well. So that is something that you might want to watch out for. If you know that you already are someone that doesn't tolerate dairy well, then that's something that you will definitely would want to avoid if you're having trouble with diarrhea. Again, you can always talk to your healthcare team to see if, maybe that there's some kind of prescription or something, especially if you're someone that's having more than 6 loose stools per day. Another food that might be helpful for you to eat would be foods that might bulk up stools, like bananas or applesauce or something like that.
Yeah, great tips. I like that that advice on what to possibly eat if you're experiencing a lot of diarrhea, what to avoid. Again, that same concept of maybe smaller meals. Going into a food coma may not serve you during episodes of diarrhea. And then I also echo your recommendation to talk to your healthcare team, because sometimes some of the medicines we give do create a significant amount of diarrhea, and sometimes there are alternative options. So all great recommendations. Now, on the other spectrum, what do we suggest to patients and their loved ones who are seeing their loved ones struggle with constipation? And constipation is its own challenge that can be very uncomfortable not to evacuate. Tell us more about that.
So with constipation, you'll want to make sure that you're drinking enough fluid. So make sure, with all of these, with any of these side effects, you'll want to make sure that you're drinking enough fluid. So make sure that you're having, at least 8 cups per day. You can also get fluids from other foods such as popsicles, ice cream, gelatin, or soups, and this may help with the constipation. You could also try drinking some warm water in the morning, as this may help as well. For this one, you might want to include more fiber in your diet, coming from more things like fruits and vegetables and some whole grains. Also, you could try, if it's feasible, getting some light physical activity, maybe going for a walk, or just trying to get things moving a little bit might help with the constipation.
Right, yeah, I think that's good suggestions. Constipation is also a multifactorial thing, as you mentioned. Things that can contribute to it include your activity level, the amount of fiber or fluids you're getting. Drinking the warm fluids in the morning is a good idea because it activates the gastrocolic reflex that signals your body, hey, it's time to defecate or have a poop. So I think keeping these things in mind, and also not to get disheartened, because there's usually a solution if, beyond, if the dietary interventions are not working, you can always talk to your healthcare provider about other, prescription methods. But I think these are very solid recommendations in terms of what to do when you have constipation. So now, constipation can also be associated with another feeling that's not very comfortable, and that's feeling very gassy or bloated. And that's the icks, right? That's just, with that sensation, people feel like they can't move, or that's a little bit of a harder one to unpack. What suggestions do you have for that, Hannah?
Okay, so for patients that are experiencing, either gas or bloating, again, it's just very important to make sure that they are avoiding foods that may be potentially irritating to them, especially foods that they know that they don't tolerate very well. This could be dairy foods for some patients. For a lot of people, they will want to avoid foods that are very high in fiber. And also things such as cruciferous vegetables, so things like broccoli, cauliflower, Brussels sprouts, cabbage. These cruciferous vegetables tend to be a big culprit for gas and bloating for a lot of patients. And so some of these foods, if a patient is experiencing, having excess gas or anything like that, or bloating or discomfort, probably would want to minimize their intake of these foods.
Yeah, that's a good point. I think these cruciferous vegetables, although they're heroic in some ways with cancer, they contain really high nutrition compounds like sulforaphanes that can be cancer fighting. There's a time and a place for everything. Every virtue can have a vice. And so maybe saving some of these for later on during your journey, and cooking them, for instance, reducing their ability to cause some of these side effects, or avoiding them. Thank you so much, Hannah, for sharing all these amazing tips on how to manage GI side effects. I'd love for us to end by telling our viewers why we're here today and the reason for developing these modules.
Let's nourish ourselves.